morning, everyone. Thanks ever so much for joining us on our breakfast briefing this morning. So far, I think I can see 81 people have joined us. That number will creep up as we move into the session. Let me just introduce myself. I'm Sarah Lethbridge. I'm the Director of Executive Education and External Relations here at Cardiff Business School. And this breakfast briefing is part of our series to show you all of the wonderful research undertaken by our fantastic academics at the school. So we've had a summer break, we're refreshed, we're ready for a packed autumn term of events. So please do join us for some of those. The next one is in fact in a few weeks, 30th September, with Professor Debbie Foster looking at will the new normal be a disability inclusive work environment? And then quickly followed by Dr. Deborah Han talking about building back better. So all relevant breakfast briefings for the real crisis that our business community, that so many communities are facing within these COVID-19 times. If you've got any ideas about future breakfast briefings, please do contact John Parry Jones on his email there below. Yeah, just a note, you know, we're here, we're open, we're ready for business. So if you want more information about our part-time professional masters, we're kind of closed almost. We might sneak a couple more people if you're lucky on our executive MBA programme that's starting next Tuesday. And we've also got our part-time HRM, but pleased to inform you that our Masters of Public Leadership programme is still open. So please do contact us if you're interested in any of these fantastic postgraduate masters. And the good thing about them is that they're all designed to fit in around your daily working life. So do get in touch if you're interested in those. This webinar is going to be recorded, and if you'd like to put any questions to Professor Ogbonna, please do use the Q&A button at the bottom of the screen. Please follow us on Twitter. There's a hashtag breakfast briefing as well if you'd like to get involved, and Hannah in the background is going to be monitoring our Twitter feed. So it'd be, you know, a great pleasure now to hand over to Professor Emmanuel Ogbonna, who's the chair of a very important committee looking at how the BAME communities are being really badly affected by COVID-19, and he's going to share the findings of that report with you today. So we're now at 103 participants, Emmanuel, so if you'd like to take over the reins, that would be great. Thank you.
Thank you, Sarah. Thank you. And good morning, everyone, and thank you very much for joining us today. And my name is Emmanuel Ogbonna, and I am a professor in management and organization at Cardiff Business School, Cardiff University. I am very, very happy to welcome you today, although it is unfortunate that COVID-19 has again robbed us of the opportunity of having some of the wonderful hospitality that her team at the Executive Education Division of the Business School usually provide. But in saying that, I suspect you would also agree with me that without COVID-19, we probably wouldn't be having this conversation today. And certainly the interest in the conversation would not have been as much as it is today. To put that in context, I have lived in Cardiff for 35 years or so. And in that time, I haven't heard any example where people have talked about race in the way we are talking about it today. You know, race has been the elephant in the room. I've researched this area since the early 1990s and have written several academic papers in the area, and there's never been a time that such work has been as relevant as it is today. So to an extent, we owe the pandemic, terrible though it is, we owe the pandemic for some of the interest that we are seeing today in trying to equalize opportunities. So thank you for joining us today. My talk today, it's going to be focused on my reflections on some of the work we've done for the Welsh Government, and that work is continuing. I'm going to talk about the report we submitted to the Welsh Government in June. My talk will be in 3 parts, a brief opening section, and then I would present the findings of investigations. I would then share with you some of my reflections on the lessons from this work for individuals, for organizations, and for society at large. Before I start this conversation today, I'd like to talk through 3 caveats at the start. The first thing is that I recognize that not everyone is comfortable with the term BAME or BAME, or the acronym BAME. For some people, that's very problematic, and I understand that. Some people also find Black and minority ethnic problematic. Other people find people of color problematic. But if you think about it, any term we use would have its own problems and difficulties. We've chosen to use the term BAME to recognize the fact that we are talking about multiple groups of people, including, for example, Gypsy, Roma, traveler people who are not often covered in some of the discussions that are held on this topic. The second point I want to comment on in terms of the caveats is the idea that BAME groups are not homogeneous. Although we talk about them as though they are a homogeneous group, they are actually as heterogeneous as one can find. The differences within the groups can sometimes be very wide, and the differences between various subsects within those groups, if you look at the differences in women and men, between women and men, young people, different groups, etc., etc. So we have to think about it sometimes as having disadvantages that are intersected. And if we wanted to conduct a serious analysis, then we have to be looking at some sort of intersectional analysis and so on to be able to develop better insights. And the final point I want to make is that some of the issues I'm going to talk about today are going to be generic, and they would impact on people across society. So poverty, class, and for example, may well be a defining characteristics that impact on some of the areas that we're going to talk on today. But that's not what we are focusing on. We are focusing on how these factors impact on BAME people, how the singular demographic characteristic of race makes these problems even more profound for members of these particular groups that we are talking about. So in early May 2020, the First Minister and the Deputy Minister in Chief, we asked us to look into the disproportionate impact of COVID-19 on BAME communities. I was invited to lead the socioeconomic subgroup. But this report, and of course the talk that I'm giving to you today, was not based on a singular effort. It was a combined effort, and so many other people were part of the group. I don't want to spend the little time we have today discussing the methods and the membership of the group. And I urge you, if you haven't read the report, to please read the report. And hopefully the report is now being shared on the sidebar. So if you haven't read it, please read it. At some point, it would contain useful information that I would have had to give you if this was an academic paper that I was writing or presenting to mainly an academic audience. But I don't want to bore you with that. So let me start by trying to debunk a theory from the onset and to try and sell the idea to you that we have a problem in case you are still unconvinced. And for me to do that, I'm going to need to talk to you about this idea that some commentators, have put it in the media and in discussion posts, and they argue that if BAME people are dying in greater proportion, then it must be about something that they are doing. There is something about them, either their behavior or indeed their personality or indeed their genetic makeup more than anything else that is killing them. So, that's what it is. It's something to do with BAME people. They talk about people being overweight. They talk about obesity. They talk about heart disease and other comorbidities. And it's somehow accepted in some quarters, not in all quarters. But let me just try and share with you some research that emerged recently that was not talked about in the same way as many other researches. And on your screen, you will see that there was a recent study of over 14,000 patients that were admitted to hospital with COVID. And I came across a letter in the Lancet by a doctor from Southampton Hospital, a hospital in Southampton, Ravi. And he wrote this letter in the Lancet. Lancet, of course, it's a highly regarded medical journal. The doctors in the audience would know that better than myself. And so he wrote this letter trying to sift through the numbers that emerged in this study of 14,000 people. So of these 14,000 people, some of the findings, BAME patients with COVID were more likely to have diabetes, but they were also less likely to have other comorbidities such as chronic cardiac disease, pulmonary disease, kidney disease, neurological disease, malignancy, and dementia. Now, what they then did was to conduct a multivariate analysis of risk of dying from COVID, and they were able to adjust the risk to assign health or risk hazards to each of these comorbidities. And what they found was that diabetes was in fact the joint lowest comorbidity that was associated with the risk of dying from COVID-19. And that had an adjusted hazard ratio of 1.1. And the highest ratio was 1.4 on dementia. But one of the things that they then discovered, something that we've talked about, but I don't know that I've actually read much on what the risk factor was in terms of this type of hazard. What they found was that age was in fact the largest risk factor in dying from COVID-19, with an adjusted hazard of 9.09 for those people that were 70 to 79 years of age, and a staggering 11.72 for those people that were 80 and over when you compare them with people that were under 50. They then found that 60.7% of the white patients that were admitted, of these 14,000 people that were admitted to hospital, were over 70 years. Compare that with 30.7% of the black patients. So on the face of it, white patients were more likely to be older and with increased comorbidities that are associated with the higher risk of dying from COVID-19. However, surprisingly, when they looked at the death rates 30 days after hospitalization, they found that the death rates were identical for both black and white patients. So there is something somewhere, and we can move on now. Sarah, thank you. There is something somewhere that was causing the higher death rates that we couldn't possibly explain just by looking at ethnicity alone and saying black people are dying or if BAME people are dying because they were BAME. There was something about being BAME that was killing them. So it was actually appropriate for us to do the study that we did. And it was very positive of the First Minister and the Deputy Minister and Chief Whip to have asked us to do this and to have taken this seriously. So if you've looked at the report, our findings ran across 12 broad themes with well over 30 recommendations. Many of them were generic in the sense that they would apply to other members of the Welsh community, but some of them were specific to BAME groups. I'm going to go through the more important aspects of our findings relatively quickly. Then I would focus on what I consider to be the substantive findings of the investigation, and then proceed to give you my own reflections on the lessons I think we can learn from the study and from the COVID-19 outbreak in general. So the first thing that struck us when we did this study was the absence, really, of quality information on ethnicity. We simply don't have enough. So we didn't actually know for sure who was dying, where they were dying. And that's quite significant, because if you don't have this information, how are you going to really treat people? How are you going to really know that your services are fair and that all members of the community are benefiting from the services that you're providing? In particular, the NHS only has data for 85% of its staff, which looked high or higher than many organizations, but only 63% of the dental and medical staff. You know, when you consider that, and that's where you have quite a lot of members of the BAME communities, you can see that it is problematic. And it isn't just the NHS. Much of the public sector and private sector organizations simply don't have sufficient and accurate information about their staff. And that is very important, you know, because if you don't know what you have, who you employ, it's very difficult for you to be able to know whether you are being fair to the people that you do employ. The second point was the anxiety that arises from the higher risk of contracting and dying from COVID-19. This is not surprising, given that BAME people tend to be more exposed to the disease itself. They are more likely to be on the front line of service. 33% of medical and dental staff in Wales are BAME. So that's the nurses that treat us, you know, the doctors that treat us, especially the staff grade doctors, you know, those the senior doctors that don't have the training route. Mostly, many of them, not exclusively, but many of them employed from overseas trained doctors that really keep the NHS going. You know, they are very senior, very experienced. They don't have the roots to go on to become consultants, but they are the ones that are leading effectively in many of the wards in which that they are working. So all these people are exposed to the virus, or at least more exposed than the rest of us to the virus. You know, we have care workers, we have taxi drivers, you know, we have delivery drivers. You know, 40% of people from some groups, mostly Pakistani groups, for example, are chauffeurs and taxi drivers. So you can imagine the level of exposure there. And sometimes the employment pattern that either BAME people choose or that they feel are open to them, expose them to this, to the worst excesses of this pandemic, this disease. For example, many BAME people in the medical profession are locum doctors and nurses. And these are the people that are there to provide that buffer, to provide the reins of defense to us all in terms of our medical needs. And there is no greater time to fill a gap than during a pandemic, because some people who are working full-time may opt out of work during the period. But if you are a locum doctor, you really don't have much of a choice, and you don't have a say in where you are sent. And these were the people that were sent to the front line for the most part. And many of them told us they didn't have the appropriate personal protective equipment to be able to do the work they were doing. Now, our sister group developed, the risk assessment subgroup developed a risk assessment tool, which hopefully many people are using, but that is also problematic in the sense that many people have reported to us that their organizations are not fully implementing that. But hopefully this is something that has been resolved now. The other point was the effectiveness of the communication of health and social care information. Here there was a disconnect between the information that the government was putting out and the information that was reaching the grassroots. There was serious communication problems. One example of that was in vitamin D, which the government, early on in this pandemic, the government put out information asking members of the BAME communities in particular to take vitamin D supplement, to check their vitamin D levels and to take the supplement because of the potential association with that. And when we spoke to people online as part of our research, most members of the BAME communities at the grassroots levels were not aware of that information. So there was a disconnect there. There was a cultural suitability of health and social care services. There was a security of employment and income, which was a major finding, especially given that BAME communities tend to be overrepresented in sectors that are on lockdown. For example, restaurants, retailing, and self-employment. Pakistani groups, Gypsy, Roma travelers tend to be overrepresented in the self-employment route. And these people have suffered more than most in the pandemic because of lockdown. We also found that housing and overcrowding was an issue that was implicated. Of course, because you tend to have a multi-generational living in BAME communities, and then the accommodation is not always appropriate. And it's spare thought for the people that were living in small flats with many members of their communities during the pandemic, the impact that would have had on them. We talked about young people. Young people are bearing the brunt of this pandemic to an extent, to a large extent, and members of the BAME community, the young people there who are already multiply disadvantaged, are also experiencing this as additional disadvantage. We talked about the financial burden that was created by migration. People told us how they had to do multiple jobs to try and raise the money to be able to pay for visas. I didn't know this myself. I was surprised to find some people who were giving evidence to us and saying to us that for a family of 6, so the man, a man and woman and 4 children, they had to pay up to £15,000 to be able to renew their visas. It's not information that most members of society would commonly be aware of, or you would even believe. But apparently, the cost of renewing visas can be very, very high. And that can sometimes make people want to go and work, even when not working or not working the number of hours they are doing may be better for them, especially during the pandemic. And we also talked about the violence against women, children, and domestic and sexual violence, urging the government to keep funding these areas, to help women in general, but women in the BAME communities who are multiply disadvantaged in particular. But so these are, in a sense, you could argue that some of these are generic: employment, violence, and so on. They would apply to all members of the community, be they white or BAME. But we had 3 substantive findings which related directly to members of the BAME community. And I want to focus the rest of my talk on these findings. And firstly, we talked about living with racism in Wales. We talked about experiences that people had of racism and documented several. And finally, we talked about structural and systemic inequality that is embedded, really embedded, in the culture of racism in Wales and in the rest of the United Kingdom. So these were our substantive findings. And I'm going to share with you now, if you are in any doubt about the impact of racism, or indeed some people would want to argue that we are not a racist society. And if you want to know, I'll urge you to look at the report of the National Center for Social Attitude, the Social Attitude Survey that was done by NatCen in 2017. The NatCen report, which is a regular report on a variety of British attitudes towards same-sex marriage, all sorts of areas. But this particular one on race really was quite instructive in many respects, because what it did was to tell us that 26% of people admitted to being a little prejudiced or very prejudiced towards people of other races. That's significant. 26% of people, 26% of us. And these are people who admitted, and this is a concept, a subject area where people don't always come forward to say, I am racist. People don't normally do that in this country. But 26% of people clearly did. And then you can look at the European survey, where 44% of people in this country believe that some races or ethnic groups are naturally harder working. And if you think about it, how can 44% of people, some of these people will be managers, some will be executives, some will be doctors, some will be academics, lecturers, teachers in primary and secondary schools and in universities. How can you believe that and then go and be fair when you treat people in your classrooms, in your hospitals, in your organizations? It's very difficult, because the psychologists in the room will agree with us that people's attitudes usually influence their behaviors. Yes, there are times when attitudes and behaviors are not connected, but usually for that to occur, there must be radical action on the part of society, either through legislation that is enforced properly or through something else. Otherwise, if people's behaviors and their attitudes are not in sync, they are more likely to experience some sort of psychological discomfort. So it's much easier to act in the way we think or in the way we believe to be right. And this is quite significant, because developing that type of culture in society facilitates the silencing and the omission and the ordering of people, which many would argue originates from the history of slavery and colonialism. You know, some of the other things, again, that we've talked about as part of the discourse arising from this pandemic. And really, we haven't, as a society, opened ourselves to discussing these attitudes, to scrutinizing these attitudes, because people have wanted to throw it into the long grass. It's not only, it was only because of the coronavirus pandemic and the brutal murder of George Floyd in the United States that we began to open up to the pernicious impacts of racism and discrimination in society. So overall, the coronavirus pandemic is killing people, not because they are Black, Asian, or minority, but because of the racism, the discrimination that you experience because of being Black, Asian, or minority. It is the stress and the anxiety that arise from racism that reduce our immunity and that, in a sense, expose us that increase our susceptibility to the disease, increase our susceptibility to obesity, to overweight, to heart diseases, all the factors that are linked to COVID-19. What evidence do I have? And we can move on from this. We look at employment. BAME people are twice as likely to be unemployed. If you look at some groups, Pakistani groups, Bangladeshi groups, even more than twice as likely to be unemployed. All through the time the data is being collected. BAME people lose 3.2 billion pounds per year in pay gap. They're simply paid less wherever they work, in whichever organization they work. They are paid less. Black doctors, for example, are paid £10,000 less than white doctors. Black nurses earn £2,700 less than white nurses on average. Less than 2% of the FTSE 100 directors, the largest and most successful companies in Britain, less than 2% of them are British national BAMEs. And 53 organizations among these people don't employ any BAME directors. That's incredible. Less than 2%. And Baroness Ruby McGregor, in her report a few years ago, said that if we were able to increase BAME participation, give them the opportunity to contribute to their fullest, then the economy would increase its net capacity by up to 24 billion pounds. So that's a lot of money that we are actually missing out if you wanted to look at it from an economic perspective. Now, you look at other evidence, hate crime, 68% of hate crimes in Wales are against members of BAME communities. You look at healthcare, Black women are 5 times more likely to die in childbirth than white women. That is significant. The idea that a Black woman that goes into hospital with pregnancy is more likely to die than their white counterparts. It's incredible, simply unacceptable. A recent report by Public Health Wales revealed that levels of stress and anxiety amongst members of BAME community in Wales are significantly higher than those of their white counterparts. But what can we do? And I'm going to spend hopefully about the last 10 minutes I have just going over these. And the first thing is to talk about BAME individuals who may be on this call or elsewhere. And some of the things I may say may appear to be blaming the victim, and it is far from that. If I come across that way, then I apologize in advance. The first thing I would say is please be tuned into government communication. A lot of things are coming out, and if you are not tuned into that communication, you won't be aware of it. One example is the vitamin D thing that I talked about earlier. Very important. Second thing I would say is please try and stay healthy. If you haven't done this already, ask your GP for regular health checkup. Check your blood pressure, your weight, and the GPs are there to help you take advantage of that. Get a flu jab, please. And I think this applies to everyone on the call, not just members of the BAME community. Please get a flu jab this year. This is not the year you want to get a flu because, firstly, if you do get a flu, nobody would know whether it is a regular flu or COVID-19. So that would be an inconvenient thing for yourself, and that would place even more stress on the health service. And that could well make COVID nastier. So get a flu jab, even if you haven't done this in the past. Get this year. Please complete health information form and ethnicity sections, especially when you have an opportunity to do so in any data gathering. It may be very important because hopefully in the future, we will be able to have ethnicity pay gap reporting. This is something we are campaigning very strongly on, in the same way that we now have gender pay gap reporting. Please insist on having risk assessments wherever you work. If your employer doesn't do this, please let us know. We will push for it because every employer should be assessing the risk of their employees, particularly if we have already identified that these are people that are at a higher risk of catching and dying from this disease. Engage in politics, very important. Register to vote and use your vote. If we don't have political power, it's going to be very difficult to put into practice many of the things we are talking about. If we don't sit on the table where these issues are discussed, then it's going to be very difficult to put them into good use. Presently, we had two members of Senate. Unfortunately, we lost one, two BAME members of the Senate. We lost one, Mohammed Asga, a few months ago, unfortunately. And now Von Getting, who is leading the fight on this pandemic as health secretary, is the only member of the BAME community, as far as I know, in the Senate. What we want to do is to have more. There are areas where people could engage politically and become councillors and maybe even become members of the Senate. That would help. Organizations and managers, lessons. Managers, you need to equip yourselves with the tools to understand racism. The biggest problem I find is that many managers don't know, many employees, never mind a manager, don't know anything, what racism is. What they think is racism is outdated. They think it is something overt. If you spoke to people that are perhaps 40 and over, they would remember the type of incidents they saw in the 60s, 70s, if they're in their 50s, 60s, and the 80s, if they're in their 40s or something. And they would say, oh no, this isn't racism. I lived through the 70s, through the 60s, when such and such happened. That was the overt racism of the past. We no longer have that. We tend to have something that is actually more pernicious than that. The everyday racism, the subtle, the clandestine, racism that really eats away on people. So you need to equip yourself with the tools to understand racism, what white privilege means, and how structures in society perpetuate racism, so that you can understand it where you see it. You need to set aspirational targets for representation in your organization if you can. Positive action, positive action, tie break, the type of things that are legal under the legislation, but very few organizations are using them. Tie break, you are perfectly entitled to decide to select a candidate that is from an underrepresented group where you have two candidates that are of equal merit at selection panels or processes. That is legal. You can do that. There are many things you can do. Consider name-blind recruitment and insist on having diverse interview panels and shortlists. Some organizations are beginning to do this now. Make sure you have somebody that is in charge of race and commit to zero tolerance on race. Don't push it down to a department. Make a senior executive responsible for race and indeed for diversity, and insist on having zero tolerance on diversity, on race and any sort of discrimination. And for society at large, we need to think about this idea that racism is deeply seated in society. And if you want a simple example of it, unintended racism, but racism nonetheless, I'll give you an example of an organization recently, and I wouldn't name this organization. This organization recently published a list, in the last month, published a list of all the women who have helped work tirelessly during this pandemic, who have led on initiatives. And they had a list of 40 women, and all these women were white. There was no single member of the BAME community. Now, I know from the committee that I led that there were so many BAME women that worked extremely hard, tirelessly, day and night, to try and get us to where we are today. And the Welsh Government would recognize that and would happily point them out if anybody asked. But none of these people were on the list. Now, this organization is trying to remedy the situation, so I don't want to be too critical. But the point I'm making is that this list went out. Nobody checked it. Nobody sense-checked it. Nobody said, hang on, there's something odd here. Not the publishers, not the managers that looked at it, not the people that compiled the list. So we still have a problem of racism. So we need to adopt a zero tolerance on that and begin to think about it, begin to call it out where it exists. We need the government to do more, to take decisive action to address long-standing inequality in this country. We need people to support the government. We already have very committed leadership, I must add. The First Minister and the Deputy Minister and Chief Whip have a long-standing record in this area. I know that myself. But what we do need is cross-party consensus. We need to take race out of politics so that it becomes something we do because it's right, not because it is politically expedient. We need to spend more on these initiatives and not leave it to the market. We can no longer rely on voluntarism and expect companies and individuals to do the right thing. Time has come for us to adopt more compulsion. We have to make people do the right thing. We have to pass legislation on ethnic pay gap reporting. We have to compel all those people who benefit from the services or the finances of society, of the government. We have to compel them to adopt equality strategies and to be seen to be implementing those strategies. We need to call racism out wherever we see it. Finally, thank you very much for being here today. And the bare fact that so many of you registered this webinar suggests to me that we are on the right track. And I hope you will go back to your respective organizations and begin to lead this fight against racism in our community. Thank you for listening.
Thank you so much, Emmanuel. I've been trying to post relevant links in the chat function, so please do follow some of those. And we've had a few questions in, Emmanuel, if that's okay. Can you see those questions? I'll start with one. Thanks very much for an important talk. Both the George Floyd case and the disproportionate impact of COVID have got more people talking about race. However, do you think we're yet as comfortable as we need to be or should be about talking about this topic? Okay,
that's a very good question. Thank you very much. And yes, the COVID case and the George Floyd case really made it possible for us to be more comfortable talking about race. I am happy with the number of people and the approach people are taking in this area. Many organizations are now trying to do something, or at least to be seen to be doing something. Some of them inevitably will be grandstanding. Others may be genuine. But one of the things that really give me hope in this area is the activism of young people, young white people, young ethnic minority people. Not just, it's no longer something that is just left to Black and ethnic minority groups to deal with. It is now a problem that young white people have seen as part of their problem. Because let's face it, race is really not a problem for the BAME communities. They know what it is. They know what it is about. They've lived with it. And they are comfortable with who they are. Race and racism really will be problems for the white community, and they are talking about it more, which is a positive thing.
Could you give us some examples of covert racism, everyday racism that you've experienced to help us understand what people are actually up against every day?
Everyday racism comes in different ways. The simplest example would be where somebody says to you, "So where are you from then?" And then you say, okay. For me, for instance, that's always a difficult question, an interesting but difficult question. I have lived in Cardiff for 35 years, and for 3 years before then, I lived in London. And then that's well over half my life, actually a lot more than maybe 3/4 of my life, I have lived in either Cardiff or London. And then when people ask you that question, it's a difficult one to answer. And sometimes I feel obliged then, because implicit in the question is you are not one of us. So I feel obliged to say I am Nigerian. Yeah? But if I went to Nigeria, Nigerian people would then say, oh, okay, you're not from around here, are you? So effectively, there are people who often feel that by asking them some questions about their nationality, their ethnicity, it could, in a sense, be a way of trying to tell them that they are the other. And there are many examples of this in the workplace, which I think everybody that is a member of the BAME community will identify. You know, people would say all sorts of things that are subtle racism, but that you cannot really pinpoint, but are designed to undermine you, to do you down.
So you've addressed diversity on recruiting panels. Can you please give us your thoughts on equality monitoring forms that we're asked to complete as part of job application processes? Forms are collected from all sizes of businesses, from micro SMEs to large corporations. Is there a better way to help BAME communities?
No, those forms are supposed to be very useful, but the way they are presented, you know, people are often unsure what they are going to be used for. And we don't always find that they are being used for things that are positive. You know, they are designed to help an organization to know where they are and to be able to put action in place. So if I work in an organization where people collected that data and then next time round, they do something, you know, positive action as I talked about, then next time I'm going to be motivated to put that information across to them. So I think it's for organizations to do more, to show people that they are, in fact, serious about ethnicity, especially in terms of representation, you know, so that people are encouraged to complete those forms in the future.
Okay, great. Do you know if the government did any risk assessment of children attending schools in higher BAME communities?
I know that the Welsh Government have been very concerned about the impact of this in schools. And I know that they are committed to doing the best they can. Perhaps the question on what they are doing in relation to schools could be directed to other people. But I know in the discussions we've had, particularly the discussions we've had with the Deputy Minister and Chief Whip, that every working moment has been spent trying to see how the impact of this will be reduced, especially as young people and children go back to school and as people go back to employment.
Okay.
The example of that.
Thank you. Alison Parkin says, did you find any difference in the proportion of BAME people who are not furloughed compared to white groups? Are there plans to study any disproportionality in redundancy rates and provide greater gender backgrounds as well?
Again, as I said earlier, this pandemic is very gendered, really, in the way that it is taking place. But also, we know that furloughing is affecting women, young people, and members of the BAME communities more. And we are expressing to the government our concern that when the support of following to organization finishes in October, unemployment rates are likely to be even higher. And the impacts usually of unemployment, as we know from the previous recessions, usually more on BAME communities and on women. Again, that intersectional element is very important, and it's an area that we are urging the government to pay more attention.
Okay, what else have we got? I've posted the link to the risk assessment tool in the chat, guys. It took me a while to find it, but our Dean helped us there. So thank you, Rachel. I think somebody else sent me the link as well. So how do we tackle the type of lip service that organisations still give through HR policies and the practice of D&I? How do we uncover the lack of substance that still results in unfair treatment? how do we get action going, I suppose, as opposed to just presenting what we hope to see?
I talked about activism, political activism. Activism, now that people are talking about it, I actually, if I was talking to members of BAME communities now about employment and not about COVID, if I gave a talk on employment, on what to do to try and enhance your career prospect, I'll be saying to them, now is the time to go to your respective organizations and ask them what they are doing. Every organization that I know is posted a position on COVID and BAME communities. If yours hasn't, particularly if it is a large organization, if it hasn't, then you should be asking your managers, what are you doing about this? And this is the time that they should be trying to do something, trying to look at their policies and trying to implement those policies that are written. Every organization I know will tell you that they are an equal opportunity employer. Yet, the reality is often different. And it is to try and engage with those organizations, to try and apply for a position. If a position comes up now, try and apply for it and see what happens. And then if you are not treated fairly, it doesn't mean you will get the job. If you shouldn't get the job. But if you are qualified, this is probably the best time to apply for promotion in any organization. And if you don't get it, you need to ask why. And you need to be given a full explanation as to why you didn't get it. And also the help you need in how you are going to be, what you need to do to be able to get the job. One of the things I talk about when I talk about employment and employment matters is the difference on how racism operates. You asked me earlier about racism, how it operates in organizations. There's a difference in the quality of feedback that BAME communities get compared with the feedback that white communities get. If you've ever applied for a job and you didn't get it, when you come in to ask the question, why didn't I get this job? The quality of the feedback is usually very generic, never specific enough. That's because BAME people, and research has established it, BAME people tend to get filtered feedback. Again, because the managers, typically white managers, that give this feedback are often unsure, and they are worried about race or the racial element. And they think, hang on, what do I tell this person now that doesn't land me in trouble? And they skirt around the issues. So you never really know why you didn't get the job. Whereas if it was a white candidate that didn't get the job, the feedback is not filtered. It's unfiltered. Here is why. Here are the things you need to do. And I'm sure next time around you're going to get the job. So again, it's to be more specific and to question people and say, no, I'm not happy with the feedback I've been given. I need you to tell me why I didn't get the job. There's no reason why you shouldn't be assertive without being aggressive in this area.
Great. Are there any countries or places which you think Wales and the UK could learn from to better tackle racism and racial inequalities?
My talk to the Welsh Government, and I have been talking to the Deputy Minister especially and Chief Whip about this issue for over a year now, long before the pandemic. And my take on it has always been that what we should try and do is to make Wales the place where other countries in the world want to copy. We should make Wales the beacon of equality and diversity, especially in the area of race. And in doing so, we should put ourselves in a position to benefit, from the outcomes of such a process. And one of the examples I used was the letter. There was a letter that we received. I am a trustee and vice chair of Race Council, Cymru. And we received a letter a while ago from a BAME person who I think studied medicine in Wales and worked in Wales for about 2 or 3 years in his career. Fantastic CV, done a master's, distinction all through in his medical career, but felt driven away from Wales because of the racism he experienced. And he's now working somewhere in England. And I use that example and I say to the Welsh Government and others, we've actually lost in this person somebody who could have been very useful to our society. And we don't want to lose other people like this. So we want to make Wales a place that people will talk about and people would want to be coming to, not a place where people would want to be living because of racism.
Okay, thanks. And many thanks, Professor. Great presentation. Will the recommendations of this report definitely be seen through, and is there real commitment? We've had many reports and recommendations. Perhaps there's been lots of research, but these recommendations don't ever make it through to actual action. How confident are you that that's going to be the case here in Wales?
My argument, that's a very good question, actually. My argument to the Welsh Government has always been, we don't actually need more reports, because some people argue we should do more research in this area or that area. We know what the problem is. We have known what the problem is for a very long time. What we need now is action. And I personally feel that we have committed political leadership in Wales at this particular juncture. But this cabinet doesn't have an awful long left to go. And I also know, because the Welsh Government are working frantically to develop its race equality strategy. And actually, I think after this call, I have a meeting with the Deputy Minister and Chief Whip to discuss the race equality plan. So there is commitment on that side, but we need the commitment of all. You know, as the First Minister said in one of our meetings, what we need in this area is distributed leadership, not just for the government to do, but for every individual, every organization. If we all called out racism where we see it, in organizations, in our homes, people will become more aware and they would realize that the social and economic costs of racism can be significant on not just the people that experience it, but also the society at large.
Thank you so much. Thanks everyone for joining us. I think we got to about 140 people at its peak. Thanks for the questions. I'm sorry that we didn't.
Thank you.
Send made them. That'd be really fantastic if you could do that. And we'll share the report links as well. And thank you. Let's all work together. We will make a difference. Thanks, everyone.
Thank you.